So why don't we start by, we're
Yeah.
going to introduce ourselves to you, first of all. Who are we? My name is Dr. Janice Gravani. I am the Director of Behavioral Health and Wellness over here at Pelvic Rehabilitation Medicine. And I'm really excited to be here with you all doing a little bit of a Q&A with my wonderful co-presenter, talking about how mental health, psychology, and our emotions all kind of come together to impact our experience with pelvic pain.
Wonderful. And I'm Kelsey Bates. I'm a licensed mental health counselor. I'm very excited to be a part of our department here at Pelvic Rehab. And yeah, really excited to join. I'm joining from Atlanta today. I'm curious, where is everyone joining us from, if we can see? If anyone feels comfortable sharing. Got some New Yorkers, I know.
New York.
I think we probably have some people from all of our offices. We've got offices in the Midwest, all up and down the East Coast. So welcome, everybody. Oh, Australia. Fantastic.
Awesome.
Miami.
Florida. New York.
Oh, yay. Wonderful.
Texas. Welcome. And, Egypt. Wow.
Wow.
Welcome. So excited to see people from Australia, Egypt. That just blows my mind. Welcome,
fantastic.
Everybody. And, absolutely, we encourage folks to ask questions. We will try to get to them as they come in. Sometimes things on these lives scroll by so quickly that we won't be able to get to them immediately. If we don't get to your question, what we're going to do is we're going to circle back tomorrow and just answer any questions that might have been left unanswered.
Awesome.
So why don't we go ahead and get started talking a little bit about why is there a behavioral health practice attached to a physiatry practice that specializes in pelvic pain?
Yeah. Jana, I think a question I get a lot is, why would someone, if I'm going for pelvic pain, why would I be referred to behavioral health? Does that mean that they're saying the pain is in my head, that the pain isn't real? So I think that's a common question I get. I'm curious what your thoughts are.
Yeah, and I think that's such a great question because it's also something that I get a lot too. And so the very simple answer is no, your pain is 100% real, right? Mm-hmm. So that's the simple answer. The more complicated answer is that no matter where we experience pain or why, right? Whether you're experiencing chronic pain in your pelvic floor or whether you're experiencing pain in your hands because you've accidentally brushed across a hot stove, all of our pain is mediated by our brains. Right. So what that means, if our pain systems are working the way they're supposed to, and I brush against a hot stove, really quickly, a message gets sent from my hand along my spinal column into my brain. My brain starts firing, telling me to remove my hand right away from that stove before I hurt myself. And what happens with more chronic forms of pain, and I want to be careful about the use of the word chronic, right? Because I never use the word chronic to mean that pain will never get better or never improve. It's to delineate really pain that's lasted for longer than 6 months, just because we experience that as very different than acute pain. So in other words, when we're talking about our brains and neurons firing and chronic pain, the way that I think about it, right, if pain is our body's alarm system, then this is the equivalent of your smoke detector going off when you're cooking in the kitchen. Mm-hmm. So there's no fire, but now the alarm system is the problem. So there's a lot of work that we can do in behavioral health on that alarm system. So to circle back, the pain is 100% real. And there are so many things as behavioral health providers that we hope to be able to share with you in the rest of our lives today that we can do to help with that.
I love to think too of chronic pain and the way you address it is like a jigsaw puzzle. So you might have a pelvic PT, you might have a pelvic physiatrist. We're just another piece of that puzzle that can give you more tools to enhance your toolbox. So sometimes that adds to pain relief, and sometimes we see decrease in depression and anxiety. And it's just another thing at your disposal to combat some of these chronic pain symptoms.
Absolutely. And we did just get a question, right, about, you know, if I'm experiencing anxiety and depression, should I see a therapist? And we're going to talk a bit, right, about why treating anxiety and depression can also help chronic pelvic pain. But I would absolutely recommend to anyone, if you're asking yourself, should I see a therapist? Then it's a good, you know, a good answer is, yeah, why not try out a session? And really the best advice that I could give for finding a therapist is making sure you're finding somebody who's licensed to practice in the area where you live, and also somebody who is competent and has experience dealing with the issues that you're coming to them with.
Absolutely.
So, which kind of leads to our next question. And Erica, thank you for giving a shout out to therapy. We appreciate it. Kelsey, how do emotions impact pelvic pain?
So this is something, maybe if I'm explaining to a patient, so they've been referred, we've already, you know, established that the pain's not in their head. So how can this even be helpful? So ideally, or essentially, we have this pain gate theory that we can start to understand that our brains and our spines send messages up and down our nervous system of interpreting pain. So if we can start to identify, which the pain gate theory identifies, there are pain openers and pain closers. So if we can start to close the gates, then perhaps our experience of pain can decrease, right? The communication between the nervous system and the spine, all the way up to the brain, can be changed. So common pain gate openers are going to be things like physical stress. So maybe you overdid it at the gym. Maybe you're running after your kiddos all day. You know, those things can really open up physical pain. Some people have a lot of pain with standing. Some people have a lot of pain with sitting. This is going to look unique to everybody. Some emotional gate openers are stress, anxiety, feelings of depression, you know, unhelpful thinking patterns, which we'll get into. All of those things can really continue to open the gates. There's also things like lack of social support, just imbalance in your work life, your personal life, taking care of yourself. Those all can really lead to increases of pain. But specifically, if we're thinking about gate closers for emotions, if we can focus on ways to decrease our anxiety, decrease depressive symptoms, those things are going to close the pain gates, which hopefully lead to a decrease in the experience of our distress. Sometimes that might lead to physical pain relief, but absolutely we can change the way we think and behave to have a relationship in our behavior and the way that we experience our pain.
And I love that explanation. And Erica also brings up, I think, something that can also be a significant gate opener, right? Lack of familial support, lack of the right type of support. And this is something that we talk a lot about, not just with our clients. We'll tell you about our class later, but it comes up all the time, the ways in which that pelvic pain and talking about the pelvic organs, right, is so different than perhaps if I had a broken arm. Right? My arm was in a sling, and then people saw that my arm was in a sling and they could ask and offer support. And then perhaps I would feel a lot more comfortable, right, talking about my arm. So not just getting support, but getting the right type of support from people who actually believe maybe don't 100% understand what you're going through, but can offer you empathy and who you feel comfortable talking to. So that can be, getting that support can be a real significant closer.
Yeah. And there is that stigma that you brought up, Jana. You know, if it's not something you can see outside, right, of oh, I'm in pain because you can see I have a cast on, it can feel really uncomfortable to bring up, or difficult for people to understand. Almost, you know, we call this sometimes the invisible invisibility of it, the invisible illnesses that come up and are still so valid, and difficult for people to empathize with or understand, depending on, you know, who's in your inner circle. And social support, positive social support, can be that gate closer. So that's a wonderful, wonderful point.
Mm-hmm. And it does and can take a lot of effort to seek that out, for sure.
Absolutely.
And I know we made a point of saying, right, support is important, but it has to be the right type of support. Yeah. So a lot of you might be wondering, okay, are there specific, like, if I'm looking for a therapist, should I be looking for a therapist who has expertise in specific types of therapy? Because not all therapy is created equally. And so, Kelsey, I know you really like talking about this. There are particular types of therapy, right? Cognitive behavioral therapy, ACT, or acceptance and commitment therapy, and other mindfulness-based interventions that get a lot of buzz. People talk about it a lot for folks with chronic pelvic pain. So what is it about these particular modalities of therapy that you think are helpful?
Yeah. And to have the quality of support, what you just described, of am I finding a therapist that specializes in what I need? So the reason that our department uses this integrative approach of CBT and ACT is because they are truly the gold standard, evidence-based for chronic pain. There are measurable studies that we can go to. We get positive results in a shorter amount of time. I know I say this, I think Jana says, I would imagine you say it too, like, our job is to work ourselves out of a job. If you have a solid therapist using evidence-based treatment, we want you to get better. We want you to get these tools and use them on your own, right? And feel comfortable and confident. So cognitive-based therapy essentially is taking thoughts that might be more unhelpful. I believe sometimes these are categorized as irrational thoughts. I find that pretty stigmatizing, especially
I prefer helpful and unhelpful too.
Yeah. And so, I mean, chronic pain, you've already probably been denied help or gaslit at this point, right? So calling a thought irrational, especially in a medical setting, is just not going to be productive or validating. So unhelpful thoughts, and really with cognitive behavioral therapy, we can help identify maybe unhelpful thought patterns, maybe like all or nothing thinking, rigid thinking, and start to practice reframing that. So like a really simple one could be, this pain will never get better, right? That's a really common one to get stuck on, of an unhelpful thought. And it's not irrational. It feels very real. But perhaps a more helpful thought is, I am really angry that I'm feeling this way. And I know that I'm using the tools at my disposal to improve my pain in this moment, right? So it might not be, I call it puppies, sunshine, rainbows, right? We're not going for toxic positivity. We're going for this realistic reframe. I'm angry and I'm doing my best.
And I am so glad that you brought up toxic positivity. I hope you don't mind me interrupting you
No.
for a moment. But a lot of people will ask me, well, why don't you just teach people to think positively, right? And what I say from the outset of therapy is that I'm not going to teach you how to think positively, right? Because let's say we take a thought like, my pain is never going to get better. And I just start saying, okay, well, just think the opposite of that, right? Which I guess would be something like, I'm going to feel amazing tomorrow and I'm never going to be in this pain again. You're not going to believe that thought because it likely in that moment is not true. And then it's not going to influence the way that you feel. So what we're going for is realistic.
Yeah. Realistic, not unattainable and authentic. Right. I love also, we replace our buts with ands, right? So I'm angry and I have space to see that I am doing my best today, but it's really uncomfortable to hold both of these opposite feelings at the same time, which we really explore in CBT. And kind of shifting to ACT, Jana, I always love when you describe it's like a left turn. It feels very different than CBT because we're really focused on how are you thinking? What are the emotions that are coming up? And then what are the behaviors that come out of the emotions? So when we're able to actually take a left turn into mindfulness, that's when we encounter this idea of radical acceptance. So again, acceptance in this modality is not, I accept this is the way my life is. Again, that is toxic too, right? That's on one other extreme.
That's acquiescence. I always think acceptance is not acquiescence. Not giving up.
Not giving up. Acceptance is, okay, this morning I'm in pain. And I accept that my body needs a little bit more time to get moving, right? Or I accept that in this hour, I'm struggling and I need to take a break. I accept that this month might be kind of difficult. I'm starting PT. I'm starting, this new round of treatment. I accept that this may be difficult and I can stand it. So kind of bringing in even some dialectical behavior therapy as well. I mean, that's not exactly where we're going with this, but just this distress tolerance that we are capable of meeting our situation when we have support.
Absolutely. And I think the way that these all kind of come together, even though they seem like they're kind of polar opposites, they're really not. And they're very complementary treatments. Yeah. Because the idea is once you're able to teach yourself, right, we get so used to having a thought or an emotion or a physical sensation and reacting to it. Right. And once we're able to teach ourselves, okay, maybe I don't necessarily need to react to every thought, emotion, and physical sensation, that empowers me to choose.
Yeah. Yeah.
And I can decide.
When you have a choice, it feels very different than giving up.
100%.
Yeah. And mindfulness, Jana, you do such lovely work with mindfulness. And I think, you've made it very accessible, especially, which we'll kind of get to some of the tools we offer, specifically, but in groups, mindfulness doesn't have to be 20 minutes of sitting and breathing. It can be so accessible. It can be diaphragmatic breath work. It can be noticing that you're taking a walk mindfully. It can be taking a shower. I think that's a wonderful example you use, like do the steps backwards that you normally use to shower. That's a mindful exercise. Mindfulness isn't one size fits all. So I always find that if one thing doesn't work for you, that doesn't mean you're doing it wrong. It just means that there's another tool that you might like better.
And again, kind of going off of what you said, a lot of folks, I think, struggle with mindfulness because there's this belief that you can do mindfulness wrong or be bad at it somehow. And you actually can't be bad at mindfulness, right? First of all, none of us are wired, right, to be perfectly mindful at every moment. It's just not the way that our brains work. Right. And what happens with mindfulness, right, every time your mind wanders and you notice it and you bring it back to the present, that's like doing like one rep at the gym, right?
Yes.
You're actually giving yourself the opportunity to feel more comfortable with mindfulness. So it doesn't mean you're bad at it.
And non-judgmental is the key, right? Of not judging yourself in the moment.
Yes. So thank you for bringing up my favorite soapbox to get on when it comes to mindfulness. So mindfulness has become very buzzy, right? Everybody's talking about mindfulness can be used for everything, to cure everything. And I think when we talk about mindfulness, what happens is that we talk about it like 50%, right? We talk about being in the moment, right? Being in the moment, that's mindfulness. But actually, and this is borne out through research, it's not just being in the moment that's important. It's being present in the moment non-judgmentally, the non-judgmental observation of the present. And that's another thing that we're not naturally wired to do, right?
Yeah.
So again, this idea that we can somehow be bad at it every time you have a judgment, every time your mind wanders is a chance to improve.
Yeah. And I mean, I think that the research shows we have about 60,000 thoughts a day. Is that?
Yeah, something like that. Probably more.
Probably more. And yeah, I think I do too. and we can't expect them all to be helpful, right? So kind of bringing it back in CBT. They're not all going to be helpful or rooted in fact and evidence. Likewise, if we're trying to meditate, we can't expect our brains to just suddenly stop producing thoughts. So really setting up some realistic expectations with a non-judgmental lens can be a wonderful first step into mindfulness.
Absolutely.
And one question that I might have seen and that I do also hear is, you know, if I'm not in therapy right now, I'm not ready, right? I'm on the fence. What are some tools that I can use every day until I'm ready to maybe reassess or look into that?
And I think that's such a great question, right? There are a lot of reasons why either somebody might not be able to participate in therapy. And there are lots of things that you might be able to start working on that could be helpful. And I know we just spent probably the last 5-10 minutes or so talking about mindfulness, but I cannot stress enough how helpful mindfulness can be when it comes to managing chronic pelvic pain. And so first, there are a lot of free resources for mindfulness. So, and I promise I'm not getting paid by UCSD, but if you Google University of California, San Diego Center for Mindfulness, they have a giant free audio and video library filled with mindfulness exercises. If you're interested in bringing a little bit, more structure into your practice, certainly there are a lot of apps that can help you do that, like Calm and Headspace. So those can certainly be really helpful. Curable is an app. And they recently actually had a really cool talk by Dr. Evelyn Hecht, who specializes in chronic pelvic pain. I believe it was a few weeks ago. So at least that made me confident that Curable is including chronic pelvic pain in
Wonderful.
Sort of the pain conditions that they work on. So I felt more confident recommending them after that for sure. And she's, well known in the field.
Awesome.
And so, but apart from mindfulness, I think there are two other main things that you can really, really do to be helpful to yourself. So the way that I think about mental health and physical health is that they exist in a pyramid, right? And there are certain things we need to do every day to have a stable base for our pyramid. And those are your basics, right? Making sure that you're getting enough sleep, making sure that you're having adequate nutrition, hydration, some movement, not too much movement, right? Finding that balance. Really, a lot of this is all about balance. right? And so anything that you can do to build that stable base will be nothing but helpful for your emotional health and your physical health. Mm-hmm. So those are sort of the main two, right? The mindfulness and building your base. And then the other thing that's popping into my head now as well is really anything that you can do that will calm your nervous system. So trying to cultivate a meditation practice might be relaxing for some people, or a mindfulness practice. It's not going to be relaxing for everybody. And it's not necessarily the point of mindfulness. Mm-hmm. But what you can do is work on kind of cultivating a regular relaxation practice and making it a regular part of your day. And so whether we're talking about mindfulness, working on things that will calm your central nervous system, or building that stable base, routine. So making it a point to build these things into your day and to build them in one thing at a time, right? Because a lot of times, and I know I can do this a lot, and I'd be willing to bet a lot of you out there do this as well. I'm like, okay, I'm going to do all these things. They sound great. I want to feel better ASAP. And of course, but then sometimes what happens is that we set ourselves up with too much to do, and then we fail, and then we beat ourselves up. Mm-hmm. So anytime you're going to start putting some new things into your routine to help manage your pelvic pain, maybe you want to start with one thing at a time. Make sure it's doable. And then maybe add another thing.
I love that realistic goal setting, because that avoids the negative feedback loop, right? If I fail once, then I will set myself up to feel like I'm failing and maybe not try again, right? So activity pacing in the sense of what is maybe one small thing I can add to my routine this week that I know I can accomplish, even if it's just one time.
Mm-hmm. And there's kind of a point that's being made, right? Sometimes the only thing what I can do when my pain is so bad is I can't do anything. Mm-hmm. And that is okay, right? If all that you can do in that moment is lie down and breathe, then that's what you can do at that moment. And your only job in that moment is to get to the next moment. Mm-hmm. And then the next moment. Because I think that's a really common question that we get. Like, what do I do when the pain is just overwhelming?
Yeah. And the kind of sometimes unknown of this diaphragmatic breathing of really, if that's the only thing, coming back to the basics of I'm just going to focus on my breath, that it really does activate our parasympathetic nervous system that pumps the brakes and tells our body that we're safe, and starts to turn off the sympathetic nervous system, that fight or flight, that is definitely coming up when we're in pain. So that's a wonderful piece of advice. If you can't do anything at all, just breathe moment to moment. And I'm wondering, because we get a lot of inquiries about one of the courses that is offered at Pelvic Rehabilitation. And so Jana created this fantastic course called Retrain Your Pelvic Pain. So I'm curious if anyone's interested in just a psychoeducational course, what could they expect out of that?
So Retrain Pelvic Pain is a class that I'm really excited about, really passionate about. It's not therapy. So it's totally different from being in a therapy group or an individual psychotherapy session. It's very much like attending, I suppose, a university lecture or something like that. It meets for 5 weeks at a time, and each course is exactly the same. Mm-hmm. And for those 5 weeks, what we do is we spend time really learning about the mind-body connection and the psychological factors that both can increase your experience of chronic pelvic pain and influence your emotional reactivity to pain, right? Because everything, right, that we've been talking about today is that if you can learn to kind of calm the emotional reactivity, that can sometimes, right, not always, but sometimes help with the pain. Mm-hmm. And so what we really focus on are learning different theories of pain, different theories of how our thoughts and our behaviors interact with our pain. And then in each class, it's split up into about 45 minutes, 45 minutes. So the whole class is an hour and a half, and you get about 45 minutes of lecture and then 45 minutes of real world skill building. So skills that you can actually take from the class and use in your life, in the world, again, to hopefully decrease pain and decrease the emotional reactivity to pain. Mm-hmm. And, you know, some kind of common questions that I get asked about the course. We've covered the it's not therapy. But for a lot of people, this is the first time that they have ever been in a group talking about pelvic pain. And so there is no expectation, since it's not therapy, that anybody will share or disclose personal or private information about themselves with other members of the class. We have a range of participants, from folks who keep their cameras off and their mics off and they just listen, to people who have, you know, cameras on, mics on, they're fully participating. So every type and range of participation is welcome. And it's also not just for people, and we should be clear about this, who are experiencing pelvic pain. So the class is open to people, for example, who are experiencing PGAD, persistent genital arousal disorder. The class is open to participants who have extreme muscle tension but no pain. So maybe that might include difficulties with urination, bowel movement, sexual activity, all the way to the other end of the spectrum to folks who don't have enough sensation in their pelvic region. So while the class is pain focused, the skills that people learn in the class are really applicable to the range of pelvic floor disorders and the range of pelvic floor disorders that we treat at Pelvic Rehabilitation Medicine. So if anyone is interested in the class, I believe there's a link in the link to this live to get information about how to sign up for it. But if there isn't, just go to our, you know, the homepage on our Instagram, call the number, ask for a screening appointment for the Retrain Pelvic Pain class, and you'll be scheduled for an appointment for either me or Kelsey to chat with us for 5-10 minutes about what we do.
Yeah, it's such a fun class. We just wrapped up our last session, and I was able to, you know, get to learn a little bit more about the course, and it's just really a wonderful place to not feel so isolated in this experience and see there are other people also experiencing any type of pelvic health issue or sensation, discomfort, and just nice to have some sort of community and really learn tools.
Yeah, and we probably have about a couple minutes for questions if anybody wants to ask. Otherwise, again, if questions come up, you know, after this is over, any questions that are left or questions from before that might have scrolled on by and we didn't get a chance, we will definitely be circling back tomorrow to answer them. So I'll just wait a moment or two and see if any other questions come in. And as you can see, both of us are very, very passionate about this subject and could probably talk about it for hours and hours. So I'm sure we'll be back doing another one of these pretty soon.
That would be really fun. Yeah. And the wonderful thing about the course is we have people from all over joining. So just like today, I mean, that was really amazing to see how many people tuned in from different parts of the world. So this course is not limited to location, which is really wonderful to get some tools.
Absolutely. Thank you for pointing that out. Yeah. So, all right. It looks like we're ready to wrap up. This was so much fun.
Thank you so much for having me.
Thank
chatting
you
with me.
thank you for being here.
Oh.
The cost of the course. That's a good question. So it's $125 flat fee for the entire 5 weeks.
It's a great question.
Yeah. Easy question too. I like getting easy questions. So thank you. All right.
Awesome.
Well, thank you all out in Instagram world, and we'll be back soon.
Awesome. Good night, guys.
Bye.